For patients who decide to proceed with penile implant, I think most oftentimes they have tried some sort of medical therapy, whether it's oral or injectable medications, or even vacuum pumps, and have failed. So to choose penile implant is really it's a very definite way of improving and treating their underlying erectile dysfunction. During the procedure, you are going to go under anesthesia. This is making you completely asleep. The entire procedure will take about 1 hour to do. Everything will be done through a small tiny incision on the scroll region. Allow me to access your underlying tissue and allow me to place the implant within the spaces called the corpora of the penis tissue. There are 2 cylinders that goes into the corpora, right and left. There is a pump that goes into the inside of the scrotum, and a third small portion goes into a reservoir, goes into behind the bone, the pubic bone, inside your abdomen. Everything will be concealed. There's no exposure to any sort of devices or tubing outside your body. The incision, as I said, 1 incision that heals within a few weeks. And then we're able to feel the cylinders as well as the pump, which is very essential for you to use to have a normal, natural feeling erections. Patient oftentimes go home same day. We call it outpatient procedure. Or if they decide to stay in the hospital or for overnight, we call this 23-hour observation stay. In the next morning, they'll be able to go home without any tubes or any catheters. Typically, patients who decide to go for penile implant will have a thorough anesthetics or pre-operative evaluation. The team will review the medication history, your history of medical conditions that can interfere with the surgery. And once you get a clearance for the procedure, especially if you're taking anticoagulation or antiplatelet therapy, you should be stopping those medications before the procedure. Again, once you're cleared, you'll be put on the list and you'll be given a date and time for the operation. Typically, patients who will receive general anesthesia, yes, they will require transportation secured prior to the arrival to the hospital, and also accompanied by an adult member, whether a friend or family. So my nurse will provide you with a written as well as verbal instructions how to do a preoperative preparation for the procedure. That include the night before procedure canal wash with chlorhexidine scrub, as well as some skincare. There's also taking a shower before the night of procedure. These are all being addressed in the clinic before giving a date for procedure. During the preoperative anesthetic evaluation, you'll be seeing a specialized physician, anesthesiologist, to go over the medication list. And if you're taking any blood thinners like antiplatelets or anticoagulation drugs, that needs to be addressed and stopped if safe to do so prior to undergoing the procedure. Patients who are going under general anesthesia, they often require to fast for about 6 to 8 hours prior to the procedure. And again, you will be given specific instructions how to do so by the nurse or by the preoperative team. Patients who come to the hospital for overnight stay, again 23 hours observation, they will pack a small pack of their favorite food, or they have a couple of pajamas or light clothing and washing materials to accompany them during the stay in the hospital. But for those who decide to leave the hospital right after surgery, this is called an outpatient procedure, you don't need to do anything with that. You don't have to shave. I do actually trim the pubic hair to allow me to have a more cleaner skin to place the implant. So again, you don't need to shave or trim anything before the procedure. You'll be received by the anesthesia team in the pre-operative area. You'll be given a label, intravenous needle to allow them to introduce medications to make you sedated. And then from there, you'll be taken to the operative room to go sleep and receive the implant. Some patients are nervous about the day of procedure, obviously, but having a supportive family member that you trust can be very helpful. Talking to the anesthesiologist beforehand and tell him that how nervous you are. I think important also to he may give you some medication to not calm you down before going to the procedure itself. Yeah.
Who should I call if I...
Usually we provide you with my nurse number and my clinic number that you're able to reach within the working hours between the time of 8 till 4 p.m. After hours, obviously, you'll be able to reach the on-call doctor in the hospital should you have any emergent questions.